Okay, you guys, so I often get asked by many patients what to do if their toenail falls off. So if your toenail is falling off, it can definitely be worrisome. And in this video, we're going to go over everything and all the causes on why toenails fall off and what to do about it. So what causes toenails to fall off? So the first thing that often causes toenails to fall off is a subungual hematoma. And in the event of toenail injury, you might find yourself dealing with this, the subungual hematoma, which is often a result of loosening of the toenail for many people, and it basically refers to the accumulation of blood under the toenail, usually from an injury. And imagine like accidentally dropping a heavy object on your toe, and this could actually lead to bruising and the buildup of blood beneath the nail. And if the volume of blood is significant, the pressure actually that it creates can lift up the nail and cause it to loosen and ultimately just detach off. And interestingly, there's cases where a subungual hematoma may develop and you may not even realize it. Like for instance, if you frequently wear tight shoes that cause your toes to kind of repeatedly hit against the edge of it, you may not even be aware that your toenails are turning black. And this is actually pretty common in people who have numbness in their feet, like people who are diabetic and have neuropathy because they lack sensation in their toes, and they may not kind of register that there's even like an injury in the area. Also, we see it quite often in runners too, who develop subungual hematomas, commonly due to the repetitive impact of their toes against the front of their shoes when they're running. So if you notice that more than half of the toenail is has blood underneath it, there's a high chance that the toenail just may be on the verge of falling off. If it's less than 50% of the nail, then the toenail usually won't fall off. So if you're dealing with a subungual hematoma at home, there's a few different remedies that can help to alleviate some of the discomfort and help with the healing. It's important to keep the foot elevated and apply a cold pack onto the toe to help reduce the swelling, especially if the hematoma is painful. You can take over-the-counter pain relievers like Motrin to help to manage the pain, and you can also soak your toe in Epsom salt, and that can help to reduce some of the pain that you experience. Another issue that causes toenails to fall off is fungal infection. Fungal infections can significantly contribute to toenail loss in a lot of individuals. So when you contract a fungal infection, you might notice that it causes changes in your nails. The nails may thicken and they become yellow or white in color. And the presence of fungus not only affects the nail plate, but also extends into the nail bed. And over time, that fungus can cause the buildup of all this debris underneath the nail, and that can actually lead to loosening of the toenail and detachment of the toenail. And usually you won't even notice pain from this, but just remember that fungal infections are contagious and they can be picked up from walking barefoot places. So if your toenails are starting to get loose from the fungus, make sure you're not sharing socks and things like that. Allow the nail to kind of naturally fall off and notify your foot doctor to get treatment for that. So another condition that can cause toenails to fall off is psoriasis. So psoriasis is an autoimmune condition that can actually cause skin cells to multiply at a quick rate, and this can cause specific changes to occur in the nails, such as ridging of the toenails, pitting of the toenails, loosening of the toenails, and also hardening of the toenails. And psoriasis can cause arthritis in the small joints in your toes. And interestingly, a study done in the Journal of Rheumatology revealed that the loosening of the toenail has a strong association with psoriatic arthritis. This means that if you have psoriatic arthritis in your toes, you may notice that your toenails loosen more compared to people who don't have psoriatic arthritis. Number 4, medications. So certain medications can cause your nails to become loose. Certain chemotherapy drugs like paclitaxel can cause the toenails to loosen from the underlying nail bed. And other medications that can cause your toenail to fall off are antibiotics that contain tetracyclines and also certain anti-inflammatory medications. Another cause loosening of the toenails can occur from thyroid conditions. So thyroid dysfunction can affect the shape and the appearance of the toenails, and loosening of the toenails can be seen in hyperthyroidism mostly, but can also be seen in hypothyroidism as well. And then there's also just unknown causes called idiopathic causes on why the toenail may fall off. If you grow out your toenails too long, they can be susceptible to injury. If your toenails are exposed to like wet environments regularly, your nail may be at risk of loosening and falling off. Overzealous manicures can also cause the nails to loosen and fall off. So basically, what should you do when your toenail's falling off? So when you notice that your toenail's beginning to loosen, it's important to kind of respond quickly to make sure that there's no further damage. You can start by gently cleansing the affected toe using just soap and water. Then use some nail clippers and just kind of trim away the sharp edges at the end of the nail to ensure that it doesn't like catch on anything. And it's important to cut the nail straight across and try to avoid any jagged edges when trimming. After you do this, apply an antibiotic cream to the toenail, such as Neosporin, and cover it with the Band-Aid to kind of secure that nail plate back onto the nail bed. If you find that it's kind of difficult to reach the toenails, don't hesitate to call your foot doctor who can help you with this. But if a heavy object falls on your toenail that kind of results in a painful hematoma, it's important to make an appointment with your doctor right away, because that accumulated blood underneath the toenail can cause a lot of pain for people and usually requires toenail removal. And to manage the pain, you could take a anti-inflammatory medication like Motrin until you see your doctor. And after the toenail is removed, resuming your normal activities is usually possible. As long as the nail bed is clean, it's okay to start painting your nail bed and kind of waiting for that nail plate to grow back, which can take 8 to 12 months even in some people. If you notice though that you're developing pain and redness and signs of infection, make sure you contact your foot doctor right away. And there's also some unique nail stickers that you can actually apply to the nail bed safely. Just try to avoid harsh glues on the nail bed and acrylic nails, because they can be kind of hard to secure onto the toes. Whatever you do, just make sure to not, glue your lost toenail back onto the nail bed. This is just unsanitary, and it can create a portal of entry for some bacteria. And then what are treatments to help your nail grow back faster? I often get a lot of patients asking me this. So although you can't necessarily force your toenails to grow faster, there are some things that you can do that can help. You can take a biotin supplement, which will help to support nail growth. Avoid using kind of harsh soaps on your toes, and make sure to kind of keep them clean and dry so that they grow out nicely. And what if your toenails actually grow back thick once your toenails fall off? So if your toenail grows back thick and you want to know how you can thin it down, you can actually use some nail softening agents. I prefer urea 47% nail gel that you can apply directly onto the nail. I'll attach a link in the description for you guys. Urea breaks down that hard keratin in the skin and the nails, and it'll take a long time to work, but it can be beneficial in helping to thin out that nail a little bit as it grows out. And another alternative would just to be applying vitamin E oil onto the nails daily, and this can help to strengthen the nails and help to keep them hydrated. However, your toenail, if you have toenail fungus and it's growing back thick and discolored, all of these softening agents aren't going to work. You'll actually need to treat the fungal nail infection with an antifungal directly by topical antifungal therapy or oral antifungal therapy prescriptions from your doctor. And there's home remedies for fungal toenails that you can try in the meantime, such as rubbing Vicks Vapor Rub onto the toenail plates every day, which can help to soften the nails, or even tea tree oil. So that's it for this video today, guys. If you guys appreciate the hours that it takes to create a video like this, make sure you hit that like button and subscribe to my channel for more videos just like this one.